Hi, my name is Casey Richards, and my topic is on the emotional challenges of interpreting in the mental health setting. First off, as an introduction, my research question is, what are the emotional challenges of being an interpreter in the mental health setting? How do you cope with the stress of the job? And also the name of my interviewee is Miss Wendy Darling. She works at the Alabama Department of Rehabilitation Services in Montgomery, and she is a certified interpreter. She worked for 6 years as a mental health interpreter, and before that she was a community interpreter, and in some of that interpreting she had to interpret in the mental health setting, so she's had lots of experience in the field. So let's get to the literature. First, in 1980, Gerber expressed two challenges that mental health interpreters face, being the expression of language and emotions and the therapy dynamics with a third party. Expression of language and emotions basically talks about how deaf people have their own way of expressing their emotions through their language, and it is a very expressive language in general, and sometimes conveying that information to a mental health professional, they might think that it's a little over the top, when actually it's just culturally relevant to deaf culture. So that can present a challenge. Also, having to interpret experiences and thoughts of a deaf person and change that into English can also be a challenge as well. Therapy dynamics with a third party. Lots of times in the therapy setting, it's just the therapist and the client, and that relationship is very important in order for the therapy to work. So when you throw a third person into the mix, such as an interpreter, it can kind of create an off-balance dynamic. So the interpreter really has to make sure that they know the goals of the therapy and that they work in conjunction with the therapist in order to help the client. In 2000, the RID Professional Standards Committee found 3 problems, including linguistic considerations, contextual dimensions, and interpersonal dynamics. Linguistic considerations are things such as, whether the client is alingual or disfluent, as that can present challenges. The terminology of the mental health field is very vast, so you have to have a good knowledge of that. And also just the language of therapy and speaking in a therapeutic language is very important and can be a challenge. Contextual dimensions, the challenges there are, being able to adapt to different settings and interpreting for mental health in those different settings. Also, making sure that the goals of the therapy, that you align with those and that you work with that therapist to make sure that you abide by those goals. And also being able to remain stable in emotionally charged situations and keeping yourself grounded. In 2001, Vernon and Miller talked about 4 problems, including the lack of language skills, cultural differences, emotional situations, and insensitive health professionals. Deaf people, depending on how much language they have, if they've been exposed to ASL, if they have not, or if they've been taught with the oralism method, there's different things that can account to how much language they've actually acquired, but most deaf people are usually on a 4th to 5th grade level. So those lack of language skills can cause problems sometimes, as they may not, be fluent in ASL yet, or they may use home signs, so to speak, that you don't necessarily know the meaning of as an interpreter because it's not, part of the actual language. That can present some problems. Cultural differences, mediating those differences between hearing culture and deaf culture can be a challenge. Being in situations that are very emotional and can affect the interpreter, maybe the content that they're having to interpret is a little upsetting or, very alarming, and that can be an emotional challenge. Also, health professionals who just don't understand the deaf community or deaf people can maybe kind of be insensitive and not be understanding of their specific needs. Corns and Napier, finally, in 2005, outlined 3 problems, including accurately conveying message content, sensitive dynamics due to presence of interpreter, and provocative material, which we've already talked about some. Linguistic challenges, having to expand upon very vague questions that the mental health professional might ask sometimes, such as, what is your mood? And, an accurate interpretation of ASL would include things such as, how do you feel? Do you feel good? Do you feel bad? Are you anxious? Are you calm? How do you feel? And, really expanding upon that. Also, it can be hard whenever they have those minimal language skills to express the context of the message. and get that fully across, because it can be hard to understand sometimes. Sensitive dynamics due to the presence of the interpreter, like we talked about before, about how including that third party member can kind of alter the relationship between the therapist and the client. And you got to make sure that the deaf person is aware that, hey, this is a team effort. We all have to collaborate. It's a collaborative thing. It's not just me and you. You know, this is the therapist. You need to respect them. You need to talk to them, and I will facilitate the communication between you two. And also the provocative material, you know, naturally in mental health settings, you're going to be dealing with some content that's very uncomfortable and things like that. So after reviewing the literature and researching the topic, I created a list of 10 interview questions that I wanted to ask the interpreter that I found. I then sent out email recruitment to different interpreters asking if they would be willing for me to meet with them and ask them questions about interpreting in the mental health field. After I got my responses, I selected my participant, which was Miss Wendy Darling, and I set up our interview. And then I went and actually conducted the interview at her workplace at the Alabama Department of Rehabilitation Services in Montgomery. And then after the interview, I sat down and reviewed the recording of the interview and analyzed the results, and this is what I found. Some emotional challenges, and we can set this kind of up in the demand control schema take of things. Some emotional challenges she mentioned were definitely listening to people's problems. She said it can often be disconcerting, you know, just having to interpret the situations that they've been through and the experiences they're having with their mental health, especially so whenever they're newly diagnosed and aren't really sure of how the procedure goes and everything. Language disfluency, like we mentioned before, you know, having to deal with patients or clients who don't have full language capabilities. It can be hard to interpret what they're trying to say and also interpret things to them as well to get them to understand. She said it can be really hard whenever you have a client that you're interpreting for who is a self-harmer, you know, maybe cuts themselves or has an eating disorder where they make, you know, binging and purging and things of that nature. She said it can be very emotional seeing the effects of that, and also seeing violent consumers, you know, attack somebody else, maybe the therapist or someone else in the room, or lash out at them. She said it can be very emotional. The content of the message that's being conveyed sometimes can be very emotional in itself, you know, where she's having to, you know, recount the instance of someone being raped or being molested as a child and some of those traumatic childhood experiences. She said it can really get to her sometimes, and that is very stressful. And through that, you know, kind of living vicarious trauma, you know, things that are a little bit more relatable, can be very disconcerting when you're having to interpret the story from the deaf consumer to the hearing therapist. And also unstable client. She recalled one time how she had a client who, after she had interpreted for him a couple times, you know, was making advances on her like, oh, I wish you would just divorce your husband and come marry me because I love you and I treat you right. And, you know, she just kind of tried to brush it off a little bit, but it got to the point where he would actually follow her from work on the freeway, you know, ride parallel beside her, waving and blowing her kisses and things like that. So unstable clients can definitely be a challenge. Some coping techniques, though, that she said to help her deal with all of the stress, the first thing was definitely have a pastime activity. And she said she enjoys reading. She said find something that relaxes you and that can help you get your mind off of work and your clients and things like that. Also, massages to help alleviate some of the stress. She goes at least once a month to get a massage to work out some of the stress in her body. She also takes naps. She said a lot of times she'll get stress headaches, and she said just going to sleep for an hour or two will help alleviate that symptom and help her feel a lot more refreshed and relaxed. Having a confidant, for example, her supervisor, like if she gets done with a very difficult interpreting situation and needs somebody to talk to about it, or needs to make sure that everything that she did was ethical, you know, she has that person to talk to kind of relieve some of that internal built-up stress and keep herself in check. She said making sure to ground your emotions. She said when you're in the situation, you really have to make sure that you're stable and that you remain neutral, because a lot of times it's hard to do that. And one of the ways that she does that a lot of times is by praying. To just says, God, you know, help me get through this, not just for my sake, but for the sake of the client and for the betterment of their lives. And she said also you have to remember that even when you feel empathetic towards a client, you have to remember that it's their problem and it's not yours. that you're there for them to help them through it, and that while you may empathize with them about that problem, that it's not your burden to carry. You have to remember that it's their problem and you're there just to help facilitate the communication so that they can get help. And those were all of the coping techniques that she used. And so here are all of my references at the end. And if you have any questions, just mention it in the comments on Blackboard or email me and let me know. So thank you guys.